Welcome, doctors. You walk into your clinic tomorrow morning, and instead of juggling patient calls, updating charts, and dealing with endless insurance verifications before even seeing your first patient, it's all already done smoothly, without the chaos. Sounds like a dream, right? Well, in 2025, that dream is reality, thanks to virtual medical assistants. Here's the thing, this isn't some futuristic concept anymore. Virtual medical assistants (VMAs) are here right now, transforming how healthcare teams like yours work every single day. And honestly, they're becoming less of a nice-to-have and more of a must-have. Why? Because the challenges we face in healthcare today are enormous. Provider burnout is at an all-time high. Patients expect more and faster care than ever before. And staffing shortages? They're crippling clinics nationwide. That's where VMAs step in. These highly trained, HIPAA-compliant professionals take on your most time-consuming administrative tasks: appointment scheduling, insurance eligibility checks, prior authorizations, patient follow-ups, even telehealth coordination. They handle the paperwork and phone calls so you can do what you trained for, care for patients. And the results? Incredible. Imagine your staff focusing on patient care instead of administrative chaos. Imagine patients feeling more connected and cared for because follow-ups happen on time, every time. Let's talk specifics. In 2025, VMAs are offering practices 3 unbeatable advantages. First, cost savings. Clinics using VMAs see up to 60 to 70% savings on administrative costs compared to hiring in-office staff. Second, expertise. These aren't general virtual assistants, they're HIPAA-trained and deeply familiar with U.S. healthcare workflows. And third, availability. Need evening follow-ups? Weekend appointment scheduling? It's handled. Even better, many VMAs now integrate seamlessly with AI tools, working alongside AI scribes and telehealth platforms to create a truly streamlined virtual care experience. Here's a real-world example. A family practice partnered with Staffingly to bring on a virtual medical assistant. Within 3 months, they increased their patient capacity by 40%, cut after-hours admin tasks by 75%. Their entire team reported feeling less stressed and more focused. Patients were happier too. So how do you hire a VMA without the headache? It's simpler than you think. Start by partnering with a HIPAA-compliant provider like Staffingly, Inc. Define exactly what you need, whether it's insurance support, telehealth coordination, or patient communication. Then, let them handle onboarding, EHR setup, and training. Treat your VMA as an extension of your team, because that's exactly what they are. And if you're wondering about compliance or integration, here's what you need to know. Yes, VMAs are HIPAA compliant. Yes, they work with EHR systems like Epic, Athenahealth, Cerner, and all scripts. And yes, you can onboard one in as little as 1 to 2 weeks. Doctors, here's the bottom line: virtual medical assistants are no longer optional. They're the key to running a smoother, smarter, and more cost-effective practice in 2025. By offloading the admin grind, you reclaim your time, your team finds relief, and your patients get the attentive care they deserve. So if you've been feeling the pressure of staffing gaps and rising administrative demands, it's time to bring in virtual support. Because the future of healthcare isn't just virtual, it's efficient, it's patient-centered, and it's here right now. Thank you, doctors.